Thank you for this opportunity to speak about the IELSG37 study. I am Emanuele Zucca, professor of oncology at the University of Southern Switzerland in Bellinzona and Lugano, and I am a lymphoma consultant at the Oncology Institute of Southern Switzerland and the scientific director of the International Extranodal Lymphoma Study Group. The IELSG37 trial was designed to answer an open question, a long-lasting controversy in the management of primary mediastinal B-cell lymphoma. This type of lymphoma is a relatively rare disease entity, which usually affect young people, mainly young women, and presents with a bulky mass in the mediastinum, often causing compressive symptoms and requiring immediate treatment. The outcome of this patient is most often good. However, patients relapsing or failing frontline immunochemotherapy have often a very poor outcome. For this reason, historically, radiation therapy has been widely used to consolidate the remission achieved by immunochemotherapy. More recent data have suggested that properly intensive immunochemotherapy may spare the need of radiotherapy, but a consensus was never achieved, and the initial very promising results were not fully confirmed. For this reason, we launched this study, which is a randomizing patient achieving a complete metabolic remission as determined by PET scan at the end of immunochemotherapy to receive either 30 gray radiotherapy on the mediastinum or observation only. And our study demonstrates a difference of around 2% between radiotherapy and observation in the 30 months survival after immunochemotherapy, with patients receiving radiotherapy achieving a progression-free survival of 98.5% and those only observed of 96.2%. This small difference is not statistically significant and is not clinically relevant as well, since in both arms, patients are alive at 3 years with a survival rate of 99%. And this study would finally provide the lacking evidence to say that radiotherapy can be spared to patients in complete remission. And this is very good news, because if radiotherapy from one side might consolidate responses, on the other side is associated with a higher risk of second cancer and late cardiac toxicity, both of ischemic and valvular type.